My name is Rafael Lopes. I'm the founder of Bold Digital Health and the webinar programs chair for the Southern California. I'm the founder of Bold Digital Health and the webinar programs chair for the Southern California chapter of HIMSS. I'm going to be your moderator today. We've got an exciting program. We are going to have a kind of an accelerated session today. So we're going to be done in about 30 minutes and give you all back some time today. So let's see. I want to mention that today's session is being sponsored. So before we begin, I'd like to acknowledge that sponsorship. The session today is sponsored by SION60. SION60 helps California hospitals save money and meet current climate laws through their low-cost suite of platforms and services. Our speakers today are from SION60, and you can learn more about the company and their offerings at www.sion60, that's spelled SION 60.com. So again, welcome for joining us today. California has made it clear that climate accountability is now a core responsibility of every sector, every industry, including healthcare. Consider this, healthcare itself is responsible for about 9% of US carbon emissions. I don't know about you, but that number was surprising to me. I tended to think that manufacturing or farming maybe were the biggest contributors to carbon emissions, but that's a surprising number. Anyway, so that means that our sector is both now on the front lines of treating climate-driven health impacts and also a significant contributor to the problem. New laws don't just ask us to care for patients, they also ask us to account for emissions across the supply chain, in our facilities, and to consider these impacts in our financial planning. For healthcare leaders, it's really now about compliance, managing operational risk, and balancing the health outcomes of the populations we serve. So we hope today's discussion will provide some helpful first steps to help you navigate during these challenging times. So we will start with an informative presentation and then move on to some discussion questions. And what we will be able to answer, we hope to be able to answer any questions that come in. So chat is disabled. However, you are able to enter your questions into the Q&A panel into your Zoom browser, and we will try to answer any questions that come in or in a follow-up discussion on LinkedIn. Let me begin with some quick introductions today. So our first presenter is Andy Draper, PhD. He's a longtime environmental advocate. He's an IT leader and founded SION60 to help hospitals reduce their pollution, carbon footprint, and meet California climate laws. He has presented at many HIMSS events and is the former HIMSS Colorado chapter president. Also joining us today is Nico Brown, who is the Chief Strategy Officer at Vail Health in Vail, Colorado. Nico earned a master's in physical therapy. He is an avid rock climber, which was the inspiration for starting SION60, as the Vail community where he lives is very committed to sustainability. So let's see, were we able to get Andy back? A little bit of a technical issue. We lost Andy for a minute. So I think we will start with Nico. If you would kick us off with today's presentation or today's discussion, tell us about your organization, how you approached climate law and environmental sustainability, and tell us about that use case for Vail Health.
Happy to do it, and thanks for the introduction and time. I think, level setting, California, like Colorado, they're not too different in terms of the various pressures that we all feel in the healthcare sector. As it relates to Colorado hospitals, about 70% of Colorado hospitals are running unsustainable margins at present. And as we look at the various regulation that is really pushing us to track and reduce carbon emissions, we need to be able to do that in the most cost-effective manner possible, A. And B, when I think about the ethoses of Vail Health, and Vail Health is a large not-for-profit health system that goes all is based in Vail, Colorado, and goes about 100 miles east and west. We have ambulatory surgery, cancer centers, large behavioral health, and primary care, etc. And I guess more than anything else, we've got a very committed workforce and ethos around the idea of sustainability. And in fact, have a green team that has done an amazing job organizing various programs and people. And so when I really think about the ethos of Vail Health and I think about our mission of elevating health across our mountain communities, we can't separate that from environmental stewardship. And I think that that's an important thing when we're talking about sustainability in general. One part of sustainability can be financial sustainability, and another is the climate sustainability and different things. We think about, the if you see the graphic behind me, you see one part of the hospital and you see one part of Vail Mountain. Without snow, without the appropriate elements and taking care of that, we wouldn't have all the natural resources that we have today. In fact, last week we had a fire that popped up. I know Californians aren't strangers to fires in one bit, unfortunately. And we begin to think about all these things. Fortunately, the growth is slown due to favorable weather, but feel really good about that. We met Andy through various connections, and I would say that the relationship that we have with SION60 in a manner of taking what we were doing before and able to digitize and understand where our carbon emissions are coming from, and then if you can't measure it, you can't really manage it very well, be able to put it in place such that if and when regulations come that we have to report that here in Colorado or elsewhere, we'll be well situated to do so. But more importantly, we're able to weigh the pros and cons and the return on investment of various activities that not only lower our utility costs and usage, but also improve our environmental sustainability and reduce our footprint. So with that, I think Andy's back on. Obviously, he knows a lot more about this than I do. Maybe I'll give it to him.
Yeah, absolutely. Welcome back, Andy. All right, so let's kick it over to you. You have some presentation slides to share with the audience.
Can you hear me?
Yes.
Okay, great. All right, yeah. Hey, I've been a longtime health IT guy, and audio visual stuff is always the bane of our existence. So that was some smooth work, Nico and Raphael. And I think Nico's story is very important. Just a quick background, and then we'll go into some of the value points here and the ROI. So I'm a second generation hospital administrator and a longtime healthcare IT leader. I started at Cerner. And as you mentioned, healthcare is responsible for 9% of the carbon pollution in the United States. And if it were its own country, it'd be the fifth worst polluter in the world. And so I decided, what can I do? And we built a company. It's called SION60. SION is the last four letters of emission, and 60 is 60 months. And the goal is to take this complex problem and make it easy and cheap. And so our vision is like QuickBooks, and we'll go through it. I think the key point here is there is a profit motive, and there is the mission motive, and they've come together now more than ever, particularly in this new administration. So we'll go through the problem, the opportunity. Nico talk about Vail, and I promise everybody we'll get done here before the top of the hour. So bluntly, and I say that simply because I see a lot of presentations and I want to always make them very quick and valuable. I believe if you can't get your message across in 15 minutes nowadays or less, you can't really articulate the problem. So here's the problem. California has a climate law we're going to talk about. It is using 2025 data that's being collected now, and responsibly to report to the state in January 1st, 2026. So that's 4 months from now. Hospitals need to increase profit. The margin pressure is more than ever now with Affordable Care Act cuts, the Medicaid cuts. Hospitals, anyone who works in a hospital knows how much pollution, waste, plastic, energy, there's a huge opportunity there. There are trash audits in California, and I have seen the findings of this. There are $1 million fines for trash and what is in the trash. Electricity prices, a lot of the folks on the call today are vendors and also IT folks. And electricity prices are going up, and they will be for the next decade or more. And then finally, and this is very important, according to a Commonwealth Foundation study, 80% of employees want to know, what is your sustainability plan? So immediately, right now, all organizations in California, whether you're health or other, if you have over $1 billion worth of revenue, which most hospitals can hit that threshold, you have to report in 2026 using 2025 data, your greenhouse gas emissions, scope 1 and scope 2. And our solution does that. If you're less than $1 billion, but you have at least 500 million, you have to report your climate risks to your business and your plan to manage them. And all these are due here in 4 months. There is also a national initiative. The Joint Commission has a sustainability certification. The National Academy of Medicine has a whole decarbonization initiative for folks who are multitasking right now. And I encourage you to Google it. You can also go to our website, but if you put healthcare, sustainability, decarbonization, there are tons of resources out there. There's medical societies engaged. This is a big thing, and there are a lot of physicians and nurses who are attacking it. I did a study a couple years ago of a publicly traded hospital system, 180 hospitals, and the punchline is about 5 tons of carbon emissions are produced for every admission. And no surprise, the more intense the service, the more emissions are created. So when you look at the operating room and the ICU, longer length of stays, more intense utilization of services, you have higher emissions. So in some cases, you could have a very sick patient with surgery and a long ICU stay could produce over 20 tons of carbon emissions. I think the other thing, and this reminds me of the early days of health IT and EMRs, is most hospitals are using spreadsheets and interns. And so our goal is to make it a software platform with all kinds of data and interfaces possible. We have a team in India, and we want to make it cheap and easy, just like QuickBooks. The opportunity here is to increase the margin through a lot of different projects that I can show you: energy reduction, anesthesia gas reduction, boiler efficiency, there's over 80 projects that we have ready to go, just like content and EMR. We will do all the data input with our team in India, and we can do it asynchronously via email. We can also do interfaces. And of course, it is secure in the Azure cloud. And we have cash grants available as well. So we started this company to make it easy for hospitals to save money and do the right thing, to strengthen their margin and strengthen their mission. And we have 5 clients. We have a lot of success. So Nico was talking earlier, did a great job. Nico, you want to talk a little more about what we're doing together at Vail Health?
Yeah, as I was saying before, part of our overall strategy is, sustainability, and it takes everyone and part of the workforce. I'm really proud of the green team, and Alyssa and Tim on that team have just done such an amazing job. I think it is really important to take various things and measure that, understand kind of what your opportunities are, and understand, okay, when a capital project comes due, how do you put this into that equation and that decision-making matrix? We've got a lot of different sustainability projects. We've got various quarterly meetings, and yeah, we've been a partner with Andy and team, I guess 18 months now, and quite happy with it. I would say in terms of vendor, Andy's IT background and his team and his ability to flex and meet our varying needs and sometimes over demanding requests are something, but that's his passion, and it aligns with what our workforce and our community wants and desires as well.
There are a lot of initiatives in California, trash audits, energy audits. A lot of the local jurisdictions, city, counties also have energy regulations. And we were able to build, and I'll show this, the working with Vail, just like an EMR, and our solution is called Carbon EMR for environmental record. We took content. So we took the top 18 most used energy saving projects for health systems, and we built that in the software, and we'll show you that. And we do that at very low cost, which saves a lot of money of engineers and meets the local regulations. Just real quick summarizing the ROI, and then we'll talk about a couple of quick wins that folks can do it on their own. Energy savings is largely unmanaged. Folks, CFOs, we're in the budget process now. They will take last year's spend, add 3%, and that's it. There's not really a critical look at energy as there is in IT and other areas of hospitals. Utilities offering rebates. They're offering rebates because it helps them avoid paying capital to build new production. It's easier to give a device to reduce the motor speed than it is to build a new power plant. Employee retention, overall, physicians, particularly folks who are 40 and younger, nurses and physicians, they want to know what the sustainability strategy is. There is an ROI in this. I think, if anything, folks who are green and climate focused over the past 10 years, that has shifted. It's now all about doing good, being green pays green, and you can avoid high-priced consultants. And as we all know, as health IT people, there's a lot of consultants out there, and we wanted to do this in a QuickBooks fashion so that it's simple and automated, and you don't have to spend a lot of money. Here's some quick wins for what a health system can do. Just like an EMR rollout, any major project, establish governance. Get someone like Nico, a chief strategy officer, somebody at the C-suite's ideal. It doesn't have to be, but that would be ideal. Have a vision. We want to reduce we want to understand what is our carbon footprint. How much are we polluting? What is our plastic pounds we're producing each year? Come up with some measurements, Education's huge. There's tons of education. We have it on our website, different specialties, other organizations measure. The energy budget is ripe for savings. Every hospital, even I am doing solar now to reduce the electric cost. Our kilowatt hour price is 21 cents a kilowatt hour. It's ridiculous in Denver. We're reducing that. We can target green ICU and green OR, which is the high intensive areas, for a very low price, $5,000. Your supply chain, 40% of the carbon emissions of a hospital come through the supply chain. Supply chain leaders can engage and then involve finance. And I think the punchline for this is, just like rolling out an electronic medical record for a health system, it involves multiple teams. And as Nico, as the chief strategy officer, you have to have buy-in from IT and OR and nursing and medical staff and supply chain and pharmacy. And so it's a comprehensive model to do it correctly. In the content, we've created a project library, and this is all on the website. And the project library is done by the department of the hospital. You can see here, very sensitive. So we've taken each hospital department and we've broken out what can be done in the hospital. And then we've created content for each of these departments. So first, make a strategy, collect your data, organize it. We can do that just like an EMR brings in clinical data and supply chain data and pharmacy data. We can bring all that in at a very low cost. And then start to look at a platform. You can do it with Power BI. You could do it with a package like this, our Carbon EMR. This breaks it down. It's very much organized in a layout fashion like an electronic medical record. You got tabs on the left, data on the right. We've built in, like content, like an electronic medical record, our environmental record has built-in projects that's ready to calculate savings and carbon emissions, pollution, and time and labor, and track the ROI. And then this is an example of the automatic energy saving calculation. So a hospital can choose to hire a mechanical engineering firm for over $100,000, or they could do it automatically with software. And we took the software route because, as we all know as technologists, that's the most affordable and scalable way to do it. So in conclusion, Raphael, we have clients from Massachusetts to Kansas to Colorado, and we would love to partner in Southern California. The fires last year are horrible. There's a moral imperative. The Santa Ana winds are coming again. There's a legal imperative. If California can show the way, I know that California will help other hospitals in other states do this as well. So we're looking for an innovation partner right here for a monthly subscription and a $10,000 grant. And the grant is to help sustainability people. When we've talked to them about this, there's a question of, well, let's just reduce the price. But the sustainability folks say, hey, I need money to create action and create initiatives. And so that's why we build in a cash grant in this as well. So Raphael, that really is the path. We're about helping people, help the planet, and improve the margin. And we can do that together in the health system. And I think it would be great to work with some Southern California hospitals because you guys are all leaders. Thanks,
Thank you so much. Yeah, thanks, Andy. Thanks, Nico. Thanks for sharing really some valuable insights and a playbook for what some of our listeners in California and other states can really begin to do to get engaged and make a difference here. So it looks like we do have some questions that are coming in. So let me go get some of those. So Andy, one of the questions is, do you envision any laws pushing for the requirement and accountability of electronics recycling in the healthcare industry?
That's a great question. I think there's a profit motive in recycling electronics with getting that metal and magnets and silicon out. And so there is part of the trash audits in California, they look at what's in the garbage. And not just sharps, but also, plastics, unsanitized waste. And they pull out keyboards. I've seen pictures. And so absolutely there is a profit motive. Many recycling firms will write a check, and some will just take it off your hands, which is IT spaces are always crowded with electronics. And so getting it out is saving of labor and time, but there also may be cash.
Great. Nico, do you have any experience there at Vail Health that you want to share on this particular topic, electronics recycling?
Well, what I would say is, just like Andy said, we've got various warehouses that are full of, older equipment, and you're always trying to keep your plant up to date, whether that's your beds, it's your physical therapy equipment, or electronics. And so if you can, there's three ways to get things done in life. You can build it and do it yourself, you can buy it, or you can partner. Typically partnering or buying is the most efficient way, and building it yourself and doing it yourself can be the most costly way to do it because you can't scale it effectively. So as it relates to regulation, I don't have a crystal ball on that, but as it relates to saving money and driving margin, that I see that as a really nice partnership.
Okay, thank you. All right, we've got some questions that have come in around doctors and nurses, really wondering um, why should they care and how can they get more engaged?
Yeah, I think first of all, I would encourage IT people and folks on this call to go and engage their doctors and their administration and their nurses on, is there a sustainability plan? Are you interested in sustainability? Would you like to know some numbers around sustainability? That's not a normal question. It will be a normal question. And the answer you will get is yes. There are different specialties, use different equipment, different surgical kits. There is tons of waste. You talk to any nurse, they know there's waste. They would love to reduce it. They're waiting to be asked. Different specialty societies have different pieces that they can do. I think the challenge is bringing it all together and then having a project so that you don't fumble around for a couple of quarters trying to get a meeting together and then figuring out what you're going to pick. It's let's get a group together. You get the group that you have. You start with what you got. I always say crawl, walk, run. Just start crawling, get some projects going, track them, get some financial savings, and pretty soon your CFO is going to start saying, let's fund some more.
Awesome.
And
Okay.
and I would say, work with your HR and employee engagement teams to ask them in an anonymous way. We did that and we were blown away at the support throughout the organization for these sorts of activities. And so if you have that support and you're trying to build a workforce culture, you're trying to build engagement, you're trying to attract and retain key talent, this is one method by which you can listen and then take action. And you can take action with people in an engaging way that's always the best way to do it because healthcare is a team sport. And this is part of that.
Thank you. The next question is about measurement and maybe are you able to tell the audience if there's some low-hanging fruit, maybe some really unexpected or unknown low-hanging fruit in the health systems, and what are the metrics that organizations should really be focusing on?
I'm going to let Andy take this question, but I'm going to say goodbye to
Yeah,
everybody. Thank you so much. I'm so sorry. I have a hard stop right now, but I appreciate you. Give Andy a call. It's worth your time. Take care. Bye.
thanks very much, Nico. All right, we're going to continue for a few minutes.
Okay, sure. Thanks, Raphael. So the electricity, the bill, I think there was a report that about 1.5% of a hospital's operating expense is in electricity and gas, so energy. And then you add supply chain. So a lot of sustainability starts in the plant operations facility team. They have data. You can also get it from accounts payable. We can do an interface from different systems as well. So you get a set of data of cost and energy use. And then we've also looked at anesthesiology gases. There's a gas out there called desflurane. That's a horrible toxic gas that should be eliminated. The crazy thing is desflurane is the most expensive anesthesia gas. And so getting rid of desflurane is good for the environment and it's also reduces costs. So I think then you can go into supply chain, start looking at renewable substitutes and then vehicles. We're doing a study right now with Vail. The 10-year cost savings of a vehicle moving from an ICE or internal combustion engine truck to an electric truck is over $6,000, and that's without any tax credit because those are gone now. So there is a capital opportunity. There's an operating expense opportunity. It's just knowing where to look and then getting that data ingested as quickly as possible.
Andy, so we're in Southern California. We're in Southern California, right? But we do have folks on the call that are outside California, so they're wondering, well, what's the impact to other states, and what should they be looking at?
That's a great question. So the federal signal for this is extinguished because of this administration. But like every good democracy and economy that's driven by capitalism, it goes to the grassroots very quickly. And so every state and city has an energy reduction initiative. And particularly if you're in a blue state or a blue city, there is probably a carbon emission regulation. Two of our clients in Massachusetts has one, New York soon to have one, California, Colorado, and then Portland, Chicago. So if you go to the local level, the city level, there's usually an energy reduction requirement, which is the front door of reducing your pollution and waste. And so it's not only in the United States, across the world, this is a mature initiative. It's based on the greenhouse gas protocol. You can Google that as well, GHG protocol. It's been around for over 25 years. So this is, while the environment in the United States is different now, this is a global thing, and there is money to be saved. And I know CFOs are looking for every nickel and dime in the couches in the hallways of their hospitals.
Thank you. So we have more questions coming in, so I think we'll just keep going if you're okay with that, Andy.
Sure.
Yeah, we'll keep going a little bit. So a question has come in wondering what your thoughts are in terms of the impact to outpatient ambulatory surgery centers.
Oh, yeah. So I'm working with an ambulatory surgery center in New Jersey right now, and we're doing the same analysis. And the methodology is the same. Whether you're a health technology company, a clinic, an ambulatory surgery center, or a multi-state hospital system, you look at scope one, which are things you burn: anesthesia, gases, fleet fuels, natural gas, heating oil. Scope two is electricity, and then scope three is supply chain investments and things like that. So you break down the organization into those kind of budget items and expense items, and then you can create the carbon emissions formula, which we do in our software. And that's how it will, that's how it translates across industries and into ambulatory surgery centers and other organizations, medical device manufacturers. It's a just like accounting is a standard financial accounting, carbon emissions sustainability accounting is a mature 25-year plus carbon or accounting methodology.
Kind of on a related note, in terms of working with suppliers and vendors, what are some strategies or what are the considerations in terms of helping or looking at the organizations that are supplying you services in order to help you advance your sustainability goals?
That's a great question. So I'll tell you, as IT leaders, you can start to ask your vendors, do you have a sustainability plan and do you have a carbon emissions reduction plan? And you can put that in all the paperwork that's required, the ISA, the BAA, the contract, physician ownership. Just ask them a one-page statement. Send me your carbon emission strategy or your sustainability. You can do that for free right now. You just put it as part of the project management intake process. Supply chain has an opportunity to go to the GPO, Group Purchasing Organization, and the vendors. The vendors are waiting to hear from the buyers. It's a chicken and egg, supply and demand. The suppliers are ready to provide data, but they're waiting for the hospitals to say, I want to know what is the carbon footprint of this MRI. They have it. They want to be asked. And if you ask them, you can ask your sales rep, you can get that data, and that's really important, and that starts them to get in tune. Many years from now, there will be an analysis, as I've been in service line meetings. You look at buying a new clinic or a new robot or a new physician group expansion. You know, there's a pro forma, there's a capital cost, and then that is always reviewed. And very soon, there will be, what is the sustainability impact of this? And so as we start to view the world through a prism of sustainability and protecting patient Earth, I think these data points come very clearly.
So healthcare is about caring for people. So I love this next question. What populations are most at risk from climate impacts, and How do you think that should influence how hospitals think about and design their sustainability strategies?
Yeah. I mean, um, when I met Mary Beth 18 months ago, I was very interested and it was a dream to actually do this webinar. So thank you, Mary Beth and Raphael.
Mary Beth
Because
is on the call. She's our SoCal HIMSS chapter president.
And Southern California is ground zero for a lot of climate impact. So air, water, rain, asthma. When electricity goes out, you can't get your dialysis treatment. Dr. Perlin, who I know, who's president of the Joint Commission, in the last couple of years, up to 10% of the outpatient facilities in the United States have been closed at one time or another due to climate. If you go into Miami, the ocean is literally coming through the grates in the city of downtown Miami. There is erosion on the outer banks of North Carolina. So you look at home loss, personal loss, asthma, not access to chronic care. And then there's the facility risk. And in our software, we measure this too, because the CFO could say, I get all that, but what is the risk to this hospital being closed? Is it close to the woods? Is it close to a fire zone? Is it close in the south? There's a lot of low-lying rivers that flood very quickly now, as we saw in this horrible story in Texas over the 4th of July. Mudslides. So I think once people start, it's like there's a story of like once you see it, you can't unsee it. Once people start to look at, oh my gosh, there's all this that's out there and there's a profit motive. How do I do that? And we want to help make that cheap and easy to do.
And then another question is about what people are wondering what they can do at home, and what's the intersection of what I do at home, and what I do at work.
Yep. And that's very important to me for talking the talk and walking the walk. So I sold my internal combustion engine vehicle. We have solar on the house. We have hybrids and electric vehicle. So that's a big thing. That's going to save me a lot of money by not paying my utility the rates that they're increasing because of all these data centers. So I'm saving a lot of money right away off that. The ROI and payback for solar is within 5 or 6 years out here in Colorado because it's so sunny. Electric vehicles, there's already savings by not going and get oil changes and gas. No one likes to go to dirty gas stations. You don't have to do that anymore. Watch your plastics and then composting and things like that. So absolutely, there are tons of stuff that people can do at their home and in their workplace. And then, one thing that's kind of sinister out there that I would just ask people to think about in businesses, you have a waste paper basket and a blue basket, which is recycling. Ask your environmental services team, does that really get recycled? Because a lot of it ends up the blue bin in the middle of the night when the cleaning crews come, it gets dumped into the trash. So there's a lot of low-hanging fruit to do at home and in your office if you're an IT worker not in the hospital. But once you get in the clinical environment, it's a very robust field of savings of money and pollution.
So really eye-opening conversation, Andy. Thank you for sharing. I think we're gonna wrap it up here. So I think this will conclude the presentation for today. I'd like to thank all our participants for joining us and being valued stakeholders of the Southern California HIMSS chapter. Please look out for our newsletter in your email box. Please follow us on LinkedIn so that you can stay abreast of future events. We've got some events that we're planning for the fall and winter, so connect with us there. Also, we hope to continue this dialogue. I think there was a lot of engagement today on LinkedIn. So we'll post something in the next couple days. And let's continue the dialogue there. The webinar series was reintroduced this year after a little bit of a hiatus, so we're really interested to see what you think. Tell us what topics you'd like us to cover in the future. So at the end of the session, in your browser, a survey should automatically pop up. If you can just take 30 seconds to respond to that, we would really appreciate that. On behalf of the Southern California HIMSS chapter, thank you for joining us today and have a great rest of your day. Thanks, Andy.